Darlene Demuche Hawthorne, size 720, behavioral neuroscience, major project, closed head injury. A closed head injury is an event where the head is traumatized. However, the skull is not penetrated. The head experiences a sudden jerking motion when collides. Nerves of the brain are harmed, causing interference with signals they typically produce. Most common reason for these types of injuries is motor vehicle accidents, especially when we're considering teens and young adults in particular. Alcohol or drug abuse contributes to about 38% of severe head trauma involving young adults. Anatomy of the brain, mechanism of a closed head injury. To the left of the screen, we're looking at the different functions of the brain, which include motor skills, sensory, visual, speech, auditory, emotions. So there's a lot going on in the brain. We can see that it includes the cerebral cortex, the parietal lobe, the temporal lobe, the brain stem, the cerebellum, the frontal lobe, the occipital lobe. There's a lot of activity going on within our brain. And then to the right of that, we see the mechanism of a closed head injury. And we can kind of see how that happens, how you have the head, and it gets hit, and it gets bumped back, and then again, A, B, C, and D. Closing head injuries usually result from a slip and fall, an automobile accident, some type of altercation, an assault. Focal damage and diffuse damage occurs to the axons, and the effects tend to be broad, diffuse, and there's no penetration to the skull with a closed head injury. The different types of closed head injuries are a concussion, a contusion, a diffuse axonal injury, and an intracranial hematoma. A concussion is a mild brain injury that customarily results after a blow to the head. It can also transpire with violent shaking and movement of the head or body, and you do not have to lose consciousness to get a concussion or post-concussion syndrome. In truth, the possibility of post-concussion syndrome does not seem to be connected with the severity of the initial injury, and we'll talk a little bit later on about the post-concussion syndrome effect. Symptoms for a concussion include dizziness, headaches, nausea, vomiting, some confusion, loss of balance, maybe an inability to concentrate, ringing in the ears. Secondary symptoms are mood swings, sensitivity to light and noise, and some sleep pattern changes. Most people with a concussion recover pretty quickly and fully, but some others may have symptoms that may last for days, weeks, or even longer. Okay, the first one I'm going to talk about is the brain contusion. And as a quote, contusions occur directly beneath or contralateral to the site of impact, commonly referred to as the coup or the contracoup injury. It is most common in the orbital frontal area and the temporal tips, where acceleration, deceleration forces cause the brain to impact on the bony protuberance of the skull. You can see with a brain contusion that there is scarring, kind of like a bruise, but in this case, the brain is bruised and it's the tissue. In some cases, this can lead to hemorrhaging when absorbed into the brain tissue. If blood is absorbed into the cerebral spinal fluid, it can cause permanent neurological damage. Brain contusions are localized, which is different than concussions, because concussions are diffuse, they're spread out. Again, brain contusions are more local. Symptoms are cognitive problems, numbness, weakness, memory impairment, poor coordination, balance, and the risk factor is intracranial pressure, intracranial bleed. The diffuse axonal injury is a substantial, debilitating, traumatic brain injury. It's commonly caused high-speed automobile collisions, and it has been linked to shaken baby syndrome. It causes lasting damage to the nerves of the brain, and it may cause brain swelling, intracranial pressure. This does lead to vegetative states or comas. The chief presenting symptom of a severe diffuse axonal injury is unconsciousness or coma. Diffuse brain injury also results from the differential motion of the brain within the skull, causing a shearing and stretching of the axons. This can produce a wide spectrum of injuries, ranging from brief physiological disruption to widespread axonal tearing, called diffuse axonal injury. Give us a little more understanding on that. In addition to brain damage occurring at the time of the impact, secondary damage from severe processes may occur during the recovery period. And that is a quote. Then we get to the intracranial hematoma. This is where the brain is forced against the inside of the skull, resulting in a pool of blood outside of the blood vessels of the brain, or in between the brain and the skull, which is actually displayed in the photo to the right on my screen. The brain is not designed to drain this much fluid, and as a result, an intracranial hematoma can compress brain tissue. This can lead to unconsciousness, seizures, and lethargy. Looking at some of the symptoms, which are important, is confusion, drowsiness, headache, memory changes, paralysis, opposite side of the body that was injured, speech or language impairment, and there are other symptoms that can be displayed depending on the area of the brain that was injured. And there are 3 types of intracranial hematomas, and they're epidural, subdural, intracerebral. And intracerebral is within the brain tissue. An intracranial hematoma is very serious, and it usually will necessitate surgery, and then there's a lengthy rehabilitation time to follow. Looking at the 3 different hematomas, again, they're epidural, subdural, and intracranial. And you can see the difference on the locations of them, or the spread out of them, by the images that are displayed on the screen. And again, we can see why intracerebral is within the brain. It's actually within the brain wall. Okay. The epidural hematoma is caused by rupture between the dura mater and the skull. And that is very serious. It's bleeding that happens when one of the blood vessels under the skull is torn during an injury. And usually it also means that the skull is fractured. The subdural hematoma occurs when a vein ruptures between the brain and the dura mater, the membrane surrounding the brain, which is the dura mater, membrane surrounding the brain. Subdural hemorrhages often associated with blunt trauma, without skull fracture, and results from rotation of the brain. The progression rate is unsteady. Subdural hemorrhage may be categorized as acute or chronic, and also sometimes it may be categorized as subacute, and it depends on the rate of accumulation of blood and the rate of progression of the symptoms. For the pathology, the hematoma is encapsulated by a pseudomembrane comprised of granulation tissue derived from the inflammatory reaction in the dura. And the intracerebral hematoma occurs when blood collects within the brain tissue. Within the brain tissue. Main thing to keep in mind is the signs and symptoms may not be present for a few days or even weeks later following the impact, but to look out for, again, some of the signs and symptoms, which may be anxiety, depression, some personality changes, sleep irregularities, some cognitive impairments, concentration, memory, but just to stay focused and aware that something doesn't seem quite right. Thank goodness, I don't think I've ever seen any one person with all of this at one time, but the photo here depicts indications that there's a head injury. You know, we sometimes take it for granted we might pass someone that's in need of support. But we can see the scalp wound, fracture, swelling, discharge from the nasal passages. Somebody may be unconscious, the neck might be a little stiff. So a lot can go on. Many of these symptoms occur immediately, but some symptoms can develop and appear over time. I would say if a head injury causes a person to behave abnormally, looks like they become a little sleepy, losing their consciousness, vomiting, nauseated, having some inability to move, I would definitely call 911 and get them some assistance. Another thing to be mindful of when we're looking at different types of injuries, head injuries in particular, is to watch the eyes. Look for any changes in the sizes of the pupils. Oops. Back to this one, screen on complications. We definitely don't want to be in the red, but none of these symptoms or challenges are something that should be taken for granted. But if it's a mild head injury, nausea, short-term memory, headaches, a little more serious, you'll see some different changes, cognitive, communication may become strained, nerve damage, there may be some personality changes. And as I said, we'll talk about the post-concussion syndrome. Seizures is something to watch out for. And when it's very serious, then we're talking death, coma, vegetative states. One of the things that I'll mention is the APA notes that there is insufficient evidence to establish a definite threshold for the severity of closed head injuries, but their suggestion is that look out for 2 of the 3 of these items: a period of unconsciousness lasting more than 5 minutes, a period of post-traumatic amnesia that lasts more than 12 hours after the injury, or onset of seizures, something that's, you notice that they're getting worse, that occurs within the first 6 months after the injury or the closed head injury.